Bainey. Good evening.
Aloha Town Board. My name is Anthony Bainey, live at 21 Eisman. You know my spiel, trying to get the Town Board to pass a resolution in support of the New York Health Act. You know, there's still children that go uninsured. I've been going around getting petitions signed. I think I have 25 sheets of signatures, 18 signatures on each page. If you go and talk to like anyone who works in healthcare, I mean, especially like the nurses, I mean, they'll tell you that lack of insurance, gaps of insurance, it, you know, leads to a lot of problems, especially when people are not having preventative care, you know, properly maintained. It leads to hospitalizations. You know, not having specialty care also leads to hospitalizations. So, I mean, it's definitely a serious issue. And I mean, in terms of passing the resolution, it's really not a hard lift for the town board, or at least putting it to a town vote. I think that's very reasonable, you know. Does anyone have any thoughts on that at all?
No, I think we're good.
No?
Thank you, Mr. Bainey.
I mean, we've talked a lot about the fact that there's a cost issue with that, but I mean, the fact is that the premiums would be paid more by those who make the most money, so that it's a progressive, you know.
That's it. That's it. Your time's up.
I'm still counting in my head.
We're getting kicked out of here too.
I don't begin to claim to be an expert on health insurance, okay, which is why, because it has nothing, we don't, as I've told you numerous times, it's out, you know, we can help residents on certain issues, and there are things that we just have, that's a state issue, that's a federal issue. I mean, we got enough with our hands trying to keep, you know, the town going. We can't tackle every situation. It is a serious problem. Health insurance is a very serious problem. Make no mistake about it. It affects everybody in this country, rich, poor, everybody, inside the town and outside the town. But there's, you know, it's just not something that the town board feels that we can have any impact on. It's an Albany decision. It's a Washington decision. Okay. I just wrote a letter today to the governor on a very important issue that affected the town. Okay. And I don't know if it's gonna. I don't think it's gonna have any impact. Maybe it will. But there are things we can control, things we can't control. So, you know, you've been very persistent coming to every town board meeting, probably for 6-8 months, and I give you credit for that, as I do all the time. But it's just not something that the town board has any say over. It's not our issue. I know it's health insurance is everybody's issue. I know what you're going to say. It's everybody's concern, but we can't. We're just the Tonawanda town board. Okay, you got to get to your state elected officials. You got to get to your federal elected officials. But you can talk to us. You can come to a meeting and you can talk to us. You can see us face to face. Okay, much easier than you can probably a state elected official or a federal elected official.
Even the county legislature.
Or a county legislature. Okay, but I'm just.
Shots
I didn't
fired.
say that. I
Shots
didn't say
fired.
it. But sure, you know, and that's why we're here. We're local. We're boots on the ground people. Okay, you can come to us and complain to us, and you may not like the answer that we get, but you're going to get an answer from us. Okay, and the answer, unfortunately, in your case, is something that you probably don't want to hear. That we've been telling you that it's just we're just not. It's just not worth. Just not going to go there. Okay, that's all I'm going to say.
To be fair, I'm not internalizing this. I think
what's that?
To be fair, I'm not internalizing this. I think the majority of New Yorkers would support this, and I think that even in the town, the majority.
I don't know if you can say that.
I think I can.
Say that.
I
don't know. Maybe you can. Maybe you can't.
I'll come back with studies.
That's a pretty big statement you're making there.
That's fair.
Because it is going to come. The money's got to come from somewhere. I've had these discussions with you. There's no free rides. So whether the money comes from your left pocket or your right pocket, it's coming out of your pockets. Okay, and that's it in a nutshell, I guess, the town board position. We appreciate you coming up.
But we're paying for it with the overrunning of hospitals too. I mean,
Okay.
and that leads to the insurances going up as
Again,
well.
that's not the town board, town board doesn't control that. We don't control hospital reimbursements or anything like that, you know, so.
That's true. And I'm
Okay.
saying that the town could actually pass a resolution, but also just put it to the public vote, you know? I mean,
Public vote for what?
just put it on the ballot the way
For
that.
what? What do you
Just
want the public to vote on?
does the by this number, by voting yes or no, do you support a resolution to?
Well, you know, put that on the,
Yeah.
I understand.
I should have worded that
Every
better,
time you
but
put something on the ballot, it costs money.
okay. But I mean, there are also things that we vote on that are not necessarily pertinent to the town board. I mean, or to the
Anthony,
town. Sorry.
I think your time's up, but I'll just say this in closing, okay? If we did it, if we put a resolution before the public on everything, okay, I mean, you'd have 30 resolutions a year, okay, people to vote on, and what good would that do? They don't mean anything.
That's a strong hypothetical, and I would say that if you looked at during the Vietnam War times, there was over 1,000 municipalities across the country that passed resolutions to end the war in Vietnam, and eventually we did pull out.
Okay, all right. I'm not going back to the Vietnam War, with all due
Fair.
respect to those in the audience who may have served.
My uncle did
Okay?
too.
All right, thank you, Anthony.